Choosing a hair transplant surgeon could be overwhelming. So today I'm going to tell you everything you need to know about how to find the best hair transplant surgeon. We practice hair transplant surgery in Los Angeles, Beverly Hills, and California. We have a lot of patients from other places, but at the same time, many times people cannot travel. They're in different countries. They send us questions of how they can find the best hair transplant surgeon. Hair transplant surgery is a permanent procedure. The results of it, good or bad, stay with you for the rest of your life. So you don't want to go with the first option that comes your way. You want to educate yourself properly to see how you can guarantee the best result for yourself. First of all, education. You want to make sure the hair transplant surgeon has been properly trained and educated to be a hair transplant surgeon, not just a plastic surgeon, not a dermatologist. In many of those good programs, even if you have a good plastic surgeon, does not mean that they are capable of doing hair transplant surgery. Hair transplant is not part of the official training of many of those good programs in good schools. Hair transplant surgery has its own training. There are mentorship programs, there are fellowship programs that the surgeon has to be gone through that in order to be properly trained. Next one is certification. You have to see certain certification. They're not mandatory for a hair transplant surgeon to get those certifications to be able to do hair transplant, but it's good to show that they've gone that extra step. They've been through examinations, oral, written examinations. They are American Board of Hair Restoration, or ABHRS, has its own certification. The physicians has to have certain years of training, has to have certain cases, including certain complex cases, all has to be reported to them, and then they have to go through oral and written examination in order to get certification, and they have to repeat that every 10 years. So there is some more involved than just you doing a workshop and start doing hair transplant surgery. Certification is Fishers, F-I-S-H-R-S, Fellow of International Society of Hair Restoration Surgery. So that is given to a limited number of doctors who've proven certain elements in their basically record. So they have to have certain years of practice. Again, they have to have certain number of patients in terms of complexity of the cases. They have to be able to do different types of hair restorations, and they have to have certain lecturing or educating other doctors or have some innovations or peer-reviewed published articles in medical journals. Next one is experience. So not only doing hair transplant for 20 years is good enough. In fact, many people who've been operating for many years, they've been keeping the same old method of doing hair restoration. You have to have relevant experience, and you have to be able to show the experience of doing the state-of-the-art, the modern technology of hair restoration in that amount of time that you have been doing hair restoration. Next one is hair transplant methods. What kind of method they're using? Again, hair transplant has changed over the last 10 years. Hair transplant has drastically changed from doing a strip procedure mainly to doing mostly FUE procedure. FUE procedure has its own methods. We have different methods, different devices that makes it more of efficient and safer for the grafts and for patients to do the hair restoration with them. So the hair transplant surgeon you're choosing, they have to be able to do the most recent methods of hair restoration with the most recent devices. There are hair restorations that are involved with removing hair from body, beard, or get it from the scalp and put it on the beard. So you don't want to go to a surgeon who is only capable of doing one procedure and they don't have other options for you, because sometimes the options that we offer to patients are better than what they already have in their mind. When people coming to me and say, okay, I want to have a scalp-to-scalp hair transplant, I examine their scalp and say they don't have enough hair, or the hair they have on the donor area of the scalp is not good enough. So we examine the other options, body hair transplant, beard hair transplant, which are great for many patients. So if I don't know how to do those procedures, obviously I'm not going to offer those to my patients, and patients feel like they have more limited options. You want to ask your hair transplant surgeon, what's the method of extraction of grafts that they're using? Obviously, the older method of hair transplant was involved with removing a piece of the skin from the back. And sometimes the surgeon tells you that the result of the older method is better, and they're very honest, because they are more comfortable doing that and they're not getting good results from the FUE. You want to make sure that while you're getting the older method, if that's recommended to you. You want to know how many appointments you have after procedure, how often the physician want to see you, and how available are they to you if you need to see them. Results of hair transplant is huge. Obviously, you have to see tons of pictures. You have to see before and after picture, quality pictures. Fortunately, these days, you can find these everywhere. On the website, on social media, on review pages that patients can, actually post their own photos. So what you want to see is that those before and after pictures should be relevant. They should be having the same background, the same lighting. I can take a picture of the same person with a different lighting and show the appearance of before and after that are drastically different because the lighting is different. So you want to make sure that the system of photography is right. You want to make sure the angles are the same angles, and that's how you can see the results. And obviously the best is to see people in real person. Examination and observation is probably the best thing. You can go and examine them. Unfortunately, good hair transplants are so good that there's no way that you can tell this is a transplanted hair. So you can go to open houses, you can ask the practices to give you the contact information of some of the patient models that are willing to talk about it, go meet them in person and see how a hair transplant should be. Word of mouth is huge. Unfortunately, not many people are open to talk about the hair transplant procedure. I remember years ago when I started my practice, I was a little bit disappointed that many people are getting great results, but they're not talking about it. Some of them claim that, oh, we just use a new shampoo, because they felt uncomfortable about, talking about baldness, talking about the fact that they've been bald. So now more and more people are talking about it. More celebrities are talking about it. More sport figures are starting to educating other people about hair restoration and what could be done. So if you're lucky enough to have somebody in the circle of your friends who had a hair transplant, they can share their experience. If they have a good experience, good result, obviously that's a clear choice to go with the surgeon that they've done their procedure. In-person interview, you have to go and see the doctor. Don't just, if you have a list of few surgeons that are all looking good and they all have the good credentials, training and everything, you have to make the effort and go see all of them maybe. Don't just stop at the first one on the list. If you have a few different options, go spend your time, go talk to them. Some of them, they have a consultation fee, which is not bad. It shows that their time is limited, they're valuing their time. So that's a good investment to go see the doctor, interview with them, see what they say about your situation, and only make a decision after seeing a few of these physicians. See the hair transplant surgeon or surgeons that you have chosen to have an interview with them. You have to have a list of your questions, have everything ready. Don't just go sit there and expect them to tell you what you need. You have to be very active and interactive during the whole process of interview. You want to ask them whether or not you're a good candidate for hair transplant and why. You want to make sure that the surgeon is doing your procedure. Obviously, hair transplant surgery is a teamwork, so there's some technicians that come involved with the process and they do a certain portion of the process. But the key elements of the procedure, like designing, like extraction, should be done by physician. Make sure that the physician has a master plan for you. It's not just, okay, I'm 24-year-old, I want to bring my hairline lower. That's not, the option is not just to, okay, we give you that many hair to cover that area. They have to have a plan for the next 10, 20, and 30 years. They have to do microscopic evaluation. They have to see where you're heading from here. It's not difficult with current technology to know where you're heading in the future. If you are going toward class 7 of hair loss, the designing of hairline might be different than if you're just losing the front and there's no evidence of future hair loss behind that. Innovation and research, huge. A surgeon who is happy with the status quo is never changing the procedure, and this is a very actively changing procedure. Hair transplant surgery in last 10 years have changed significantly. So the time that I finished my training, my fellowship training in hair restoration, if I haven't done anything differently, if I didn't come up with new methods of doing things, I would have been doing the same exact method of 10 years ago. The fact is, the field is changing so fast that I cannot even wait for my textbook, the new textbook, to tell me what to do, because textbooks are usually 10 years ahead of time. So you need to be involved with innovation. You have to. If you want to help your patients, if you see there is a little things you can do a little bit better, you want to do that. So doctors who are doing innovations and inventions in the field of hair restoration are usually ahead of the game, and they're usually pushing the envelope because they care about the field and they care about the results that patients are getting. There are some warning signs of choosing hair transplant surgeon. There are certain things you have to be avoiding if possible. One is just asking your family doctor, I need a hair transplant surgeon, where I should go. So some of those family doctors are related or are aware of certain results, and they can refer you to a proper physician, but some of them they just simply don't have the information. So you have to make sure they've seen your results, that they've seen a good result of a surgeon, and then they refer you because of that. Google search. When you do Google search, Google is good and bad, or search results are good and bad. First of all, there are certain ranking that you see on the top, they're advertisements. So they are people who are paying Google or social media to put their ads over there. They're not necessarily the best, and even people who come on the top of the Google result are not necessarily the best. So they have a good website, they've been optimized properly, and they're paying money to have them coming on the top of Google. Don't assume that people who come on top of the Google are necessarily the best. Do further research, go to the website, see the results, go to the practice, talk to them, and get all other information, including certifications, the physicians, experience and everything, to see whether or not you are getting the right treatment. Don't choose a hair transplant doctor because they're the closest to you. People travel for hair transplant surgery. Again, this is a procedure that the results stay with you for the rest of your life. Many people are willing to travel in the nation or to the other countries to get the best result of hair restoration. Don't necessarily go to the first person who comes in the vicinity of your house. Well, I hope I was able to help you to get a little more educated about hair restoration and what's available in hair restoration and how to find your hair transplant surgeon. This journey might be a little bit intimidating, so do your homework, and I'm sure you can find the right hair transplant surgeon for you. If you have any other questions about this topic or any other topics, make sure you share with us in the comment section or in our social media. Also, check ParsaMohebi.com. We have tons of information that can educate you through finding the right method and right hair transplant surgeon.